Good morning, ladies and gentlemen. And this good morning comes to you from the UAE. Now, over the last few series, you may notice that in our DiaBeat webinar, we've been talking about retinopathy, nephropathy, and today we are talking about neuropathy. This only goes to show the devastating reach of diabetes. Neuropathy, as Dr. Sweata will explain, is damage to the nerves, and it is caused by several factors that could include disease, infection, injury, and so on. And there are several types. As I noticed in my reading last night, there is peripheral neuropathy, there is focal neuropathy, which of course is a problem with a single nerve, and there is polyneuropathy that affects several nerves, and there is diabetic neuropathy. The interesting outcome of my reading yesterday was that in the UAE, the most common form of neuropathy was a combination that would be diabetic peripheral polyneuropathy. From the UAE, this would seem to be a common factor. Of course, that is only casual reading. Dr. Sweata is the expert, and she will give you more precise information regarding all of that. While neuropathy could primarily result in a burning sensation in the feet, tingling sensation, as we diabetics know, and could result in sensory deficit, which means you could get injuries which you may not notice, and wounds that do not heal. And gangrene is a frightening word. 60 to 70% of diabetics have neuropathy. 5 to 10% get foot ulcers, and 1 or 2% would result in gangrene. Now, to talk about this today is Dr. Sweata. When I looked at Dr. Sweata's profile yesterday, I said aloud to myself, fascinating. The word that I use, the single word that I use to describe our speaker today is fascinating. Now, Dr. Sweata has 4, or it could be 5 academic certifications, an MBBS and an MD in medicine, a DNB in neurology. She's a fellow of the Association of Physicians in the United States. She's an MBA from Cambridge, and that's the United Kingdom. Now, as a consequence of this combination of certification, even while Dr. Sweata works in one organization, that is the RAC Hospital, she really has 2 jobs. One is as the specialist in neurology, and the second, I'm sure emanating from her UK MBA, is as a medical director. She has worked in 4 or 5 countries, and that includes Canada, South Africa, Africa, the continent, the Middle East, and from India. Over 40 scientific publications and she's a TEDx speaker. Now, here we come to the fascinating part. A whole brain master practitioner, a spiritual seeker, a past life hypnotherapist trained under Dr. Brian Weiss. She has conducted over 200 workshops And the fascinating part about this is that she has used her knowledge in brain mapping to help hundreds of students choose scientifically the best career suited them. And to top it all, she is competent in music, is a national player in table tennis, and an avid traveler, having covered over 30 countries to date, which means there is much more coming from Dr. Shweta. And ladies and gentlemen, today it is my pleasure to introduce you to my colleague and friend, Dr. Shweta.
Thank you very much, Prof, for your kind words. It's been a long journey of life, but very grateful to good Lord for the same. Am I audible well?
Yes,
Am I clearly visible? Fantastic. So
clear.
I'm going to share the slides as well. Just let me know if the slides are well visible. And since this has been a long journey of the diabetic webinars, let me begin my talk by some quiz. Whoever is present here can have a mental quiz to this. Now, UAE is a small little country. I mean, it's about what we have 150 major countries in the world. Let's see, where does UAE stand in that map in terms of the number of the diabetics in the world that UAE has. And you can throw out the random choices on the message here, and Dr. Wilco's team will be looking at it. I will keep this although until the end as a surprise. This is an absolutely stunning and surprising figure. Small little country and its world presence because of the number of the diabetics that this country has. Now, we obviously know this country is all across different expats, and this webinar is also being globally distributed. So we are all technically as a global team which is working towards diabetes. Now, my spiritual teacher used to say a very profound statement, and that has remained with me until now, last about 20-25 years that I'm associated with her, a very powerful woman indeed. And what she said was, aware, care, and dare. Unless you are aware, you are never going to care, and unless you care, you are never going to dare to make a change. And diabetic neuropathy is just exactly that. And the purpose of this webinar, thanks to Professor's team, that we are having this awareness and education. You learned about retinopathies, you learned about all the gastric complications, you learned about various lifestyle management from Dr. Wilku last time. What is important, my job here is to at least make you aware that what can you do to protect your feet. Now, we all stand on the feet. Show me one person who is able to stand without the feet being normal. So if you have amputation, if the feet is cut, if there is a sore, if there is a wound, if there is an ulcer, can that person stand on his feet? And I think the big old dictum is we all should be able to stand on our feet. And that is what diabetics may not be able to do over a period of time if and only if you are not aware. So the most important message for me today is, whatever said and done, whatever I'm going to talk, you can forget everything about it, but don't forget to care for your feet after you are aware. So why I'm going to talk why foot care is important. How often should you get tested in terms of having the, when you are a diabetic? What is the best test as clinicians when you come to us as patients? What should we do to take care of your foot and any advances, because world is moving very fast. There are regenerative therapies, which means you can grow new cells, you can actually have stem cells working to expand whatever has been lost or whatever has been degenerated. And technically, as you know, that diabetes, wherever it's affecting, it's causing the erosion of the tissue, erosion of the nerve, denudation of the nerve. So what we will check a little bit, what is the latest advance into it. I wish and I pray that one day we don't have any diabetes, but that's a far off dream. Otherwise, we would be having many more people walking around with the kind of the toe that you're seeing. Now, this is a 60-year-old guy, smoker. type 2 diabetic for last 20 years, and this is the state that losing a limb or losing a part important. And if you look at the bone x-ray, I mean, there's the x-ray is essentially put up there to know that it can also impact your bone, which means the infection not just is limited to your skin but tissue down until bone, what we call it as osteomyelitis. So this could very well have been prevented, and this is absolutely from the lack of awareness and from the lack of regular screening that this patient would have. And this is a very fresh patient of ours, so I thought I'll put it up. Now, how common are these problems? Diabetic neuropathy or diabetic foot complications is the frequent reason for hospitalization in patients in United States and Great Britain. We are no different. Technically, if you ask me, every other day, we do see patients who are walking in with diabetic foot or diabetic ulcerations, and non-healing ulcer precedes approximately 85% of all amputation. Amputation is nothing but the cutting of the limb or the leg or the hand, wherever it is, there is a gangrene, there is a damage, and 85% of all amputations, a non-healing ulcer which comes from diabetes, is responsible. Now, obviously, they are expensive complications, and 15%, which means we are 100 of us as diabetics, 15 people will have to unfortunately go through this if we don't do anything about it. So technically, this is the risk of the amputation of the lower limbs is 15 to 46 times higher in a diabetic individual. This goes on. A glaring statistic is only saying us that the message is very simple. If I don't take care, this is the state which I am definitely going to land, because this is a proven statistic, and there is no other this that we will land onto it. Now, what happens really in diabetes? Now, or forget diabetes, what is really important when it comes to our foot? So foot has a surface which is skin, then there is a subcutaneous tissue, then there is some tendons, there is muscles, there is bone, and then there are nerves which are carrying the sensation. The moment I put my foot on the ground, I know the ground is hot, cold, wet, whatever the texture of the ground is, only because my nerves are carrying the impulses across the spinal cord and hitting onto the brain. Now, if anywhere in that path, and that path could be from the small nerves which are present in the foot to the long nerve which is carrying to the spinal cord, to the spinal cord itself, and to the brain. If there is anything problem in that path, it can cause the loss of sensation or not feeling, which is what is shown here, which can lead to development of ulcers or trauma. You can hit on a stone and you won't realize because you could not feel the stone. The joint movement can be affected. There can be a lot of pressure, because now you are not able to, the body is not able to understand what kind of pressure I'm putting on the foot. There can be calluses which don't heal, and all this is contributory from the high sugar, from the type or the duration of the diabetes that you have. Some people have a very long history of diabetes. Some of them, as I showed the previous guy, the smoker. Now, smoking is another sort of a deadly combination with diabetes, because what smoking is doing is small little pipelines, blood flowing. It is clogging all that pipelines. So you have the clogged pipelines, and now you have nerve signals which are not working, which means the poor foot has nothing to rely on. Neither it is the nutrition, neither it is the removal of toxin, and that is what it can lead to more of a problem when it comes to these ulcerations and other diabetic foot related issues. Now, blindness, obviously you heard the doctor speak about retinopathies. If you have retinopathy, your chance is high for a neuropathy. If you have kidney problem or renal problem, you have high chance of having a neuropathy. And obviously, as the age advances, these are all contributing factors for development of diabetic neuropathy. So the ulceration is a simple pathway. This is like a little formula. If you don't do this, this is definitely what is going to happen. So you have a poorly controlled diabetes, you do develop the nerve problems, your intrinsic foot muscles get nerve problem, and obviously on top of it, you are wearing a wrong footwear and the pressure sensation is not properly happening. What you have is no sensation in the foot, and a little nail or a little stone is enough. There is a nice saying which says that an elephant can also be disturbed by a small ant. This is exactly like that. Like you have your big huge body, and with just a little small pebble or a stone, with all this formula, definitely can lead you to ulcer. Now, this is a beautiful photograph just to document how you can have the complete loss of these nerves when it comes to the diabetes. Now, this is a microscopic photograph of a skin cut. So there is an epidermis and a dermis. If you look at on the first half, there is a convoluted structure that you are seeing, and that convoluted structure is the presence of the nerves or the nerve fibers. And if you look at the skin below, there is nothing present. So slowly, there are steps in the occurrence of diabetic neuropathy. Some people start with what is called small fiber neuropathy, which means all the tiny small fibers which are across at the limbs are affected. Later on, the major nerves, which I just talked about, carrying the impulses, get affected, which is called large fiber or peripheral neuropathy, which means because it's present in the periphery. Now, there are also multiple types of it. There can just be one nerve, also called mononeuropathy. There can be two nerves affected. There can also be plexuses affected. So plexus is nothing but a bunch of nerves which are actually conglomerating at one spot and then sending the signal. So you can have plexopathy, you can have mononeuropathy, you can have polyneuropathy, you can have large fiber peripheral neuropathy, you can have small fiber peripheral neuropathy. So this is the extent of the involvement which people with diabetes can have. Now, the neuropathy checklist is, I believe, the simplest of the checklist. In fact, the nerves, and I always say, being a neurologist is actually like being like a mathematician. Everything in the brain is a formula. And you cannot go wrong if you are properly adhering to the formula. And the neuropathy checklist, to prevent it or not to have it as a problem, is very, very simple. Just simple blood glucose, simple screening. So every year, if there is a little small filament, monofilament, which we use. I'm not in the clinic, so I don't have it, but it's a very, very simple, thin filament. You can also use cotton instead, but the specificity of cotton won't be that high. And then obviously, I'm going to show some touching the toe test. I want every single diabetic of you, do not wait for your doctor to do the test. Doctors, you go to a busy clinic, there are a ton of patients happening around. It's your foot, it's your life. So take control and take charge of it. It's a very simple test, which I'm going to show you today. I want you all to do it and understand what are you at risk for having this neuropathy or not. So this is a simple checklist. Some people who have this pain, it all starts with burning pain, night pain, the waking up from the pain which when you go to sleep, the pain which is sharp in characteristic, the pain which is like electric current. This is all the exact symptoms what a person with already having a neuropathy can come to us, or you, if you are the one who's facing, which means it's definitely a time. This is my professor used to call it very well. It's the crying of the dying nerves. So the moment you have the crying of the dying nerve, please do take action and you need to come. The moment the burning happens, that's the time when you go to a doctor. This is the test which I was talking to you about, touch the toe test. Very, very, very simple. You have, I hope everybody has 10 toes. Some of them may have 11, which is okay. But if you have 10, please make sure that you touch each of it with a very fine cotton. Ask your spouse or your partner to do that. Close your eyes, and the partner has to just softly brush through each of the ends of the toes and mark it as yes or no. The moment you mark it as yes or no, if you have said wrong answer for 2 out of the 10, which means that's that you have failed the screening test and it's time that you go to your doctor. Okay, so it's very, very, very simple test. There's nothing, it's a feather light touch that you need to do, maybe 1 or 2 seconds, and the person has to say whether you touched it or you did not touch it. Do not do it, you do it a little bit randomly, but make a mental note of it, because otherwise the person would assume that it's one after the other toes. So do it a little smartly. But if you do this, and if you have 2 times when you failed to demonstrate that there was a touch, please, this is enough for you to go and investigate further. Now, this is the statistics what professor was talking about. 40 to 50% of the people will have a detectable neuropathy in the 10 years. So if you have already had this sort of a thing, don't be surprised if you find this test to be abnormal or not normal, because this is the normal occurrence of the potential problem which a diabetic can face. And this is what I was talking to you about. Now, let me talk about what is sensory and what is motor. Google gives you amazing things to read, but it is always important that you read in between the lines. And that is, I think, what we doctors are here for. I have put a nice big sign across on my wall of my clinic saying that I'm a second opinion after Google, and I'm perfectly fine doing that, provided, I myself as a clinician is also reading in between the lines. Otherwise, we would have had Google treating patients also. So sensory motor. Sensory is feeling the sensation, and motor is when I want to move something. I have a signal going through my brain, and that is how my hand moves or my feet moves. So some people can have a foot drop. So that means the foot is not correctly in the position, and it drops because of the weakness of the muscle. And that weakness of the muscle is called motor. Initially, most diabetics, 90% of them start as sensory small fiber, followed by sensory large fiber, and then followed by motor. So it progresses as sensory motor later on. So burning feet first, followed by obviously some ulcerations, because now you cannot understand. And then that is when the pain also can become a huge issue. Now, I have a ton of patients who come to me with pain, and believe me, guys, having a neuropathic pain is a curse. The type of the pain that it comes in the night, it is absolutely a disaster. I don't know how many of you can just put it in the chat if you do have some neuropathic pain, because it is the worst feeling ever. Most patients describe to me that that is like the worst period of the couple of hours just before going to the sleep, when the firing and the burning. And what can happen is, and I can imagine, because the intensity of that can go to an extent that you can have a complete disruption of your sleep. Now, most people who are diabetics would, if you have high blood glucose, and if you have triglycerides which are elevated, you are slightly at a more risk for neuropathy, which gets back to your annual screening checklist, that you also need to take care of your lipid profile or your cholesterol profile. Triglyceride is just one little cholesterol type which can be high. Particularly, we see it very high in people with small fiber neuropathy, and sometimes alcohol adds on to that, smoking adds on to that problem, and having all these risk factors compounds the problem. If you are very obese, that also can be one of the factors related to high or quick occurrence of diabetic neuropathy. Obviously, smoking I described multiple times, and high blood pressure as well. All these are very happy factors. I'm telling, happy for the nerve and unhappy for us, because the nerve is now joyous that all the bad factors that it needs to be completely destroyed is now present when you have the presence of all these risk factors. Now, if I'm not going to go more into this classification because I discussed a bit, but this is what we use in our clinical practice, that, and we try to say, okay, your small fiber is a problem, your large fiber is a problem, your mixed fiber is a problem, your plexus is a problem, your plexus is not a problem. And how do we do this? When you come with these symptoms, we test a machine called nerve conduction studies, NCS. So you may be hearing your doctor asking for an NCS, nerve conduction study, which is where we can detect all the potential problems. Sometimes some people have also other causes of neuropathy. Very, very, very rarely a clinician needs to do a biopsy. Biopsy is nothing but opening the nerve, looking inside a microscope to see what is going wrong inside the nerve. That is very, very rare. What we do clinically is just look at the same, what I just talked to you about, a small monofilament. Cotton can be used, but this is the best thing because the sensitivity of this is exactly determined to the sensitivity of the nerve fiber. What we do is we perform this stimulus in the same way as touch the toe test and decide and add up out of the 8 score, what is your score. And we do it in a little arrhythmic manner, so you don't know which toe we are touching. But if this is abnormal, time to be called as an early risk for diabetic neuropathy. We also use a little tuning fork because now you want to know there are basic sensations which come out from this. One of the sensation is the joint movement, other one is the touch, then one is pain, one is pressure, and one is the movement of the joint. So with the vibration or the tuning fork frequency, you can understand whether that is intact or not. Now, body is so beautifully designed, I think it's a master stroke by good Lord, that you have your touch first, followed by your pain, followed by your temperature, followed by your sensation, followed by your deep sensation and joint movement. Everything goes in one linear fashion. So initially, that is the reason why you can just have burning, followed by issues with the touch, followed by issues with pressure, ulcer, and diabetic foot, to an extent where everything just gets eroded from the extended problems of diabetic neuropathy. So once you come to the hospital, the doctor will say whether you have a normal test, then you can forget about it. Annually, just keep checking it. If you have a not so normal test, then obviously you need to have you are at high risk for having problems with foot related complications, and that is where you need to be on certain protective agents for neuropathy, which can prevent the nerve damage and also have your sugar absolutely pit pat control. So the control of sugar would have been talked about. The 3 months sugar that we talked about is the HbA1c monitoring tool, and that you need to keep it under control. We neurologists like that you are always by 6.5 in terms of the nerve care, and I'm sure that's the case with all the other organs also. We call this as end organ damage. End organ damage for the brain, the eye. So you have to remember from top to toe what are all the organs at risk. Starts with your brain, starts with eyes, starts with your peripheral nerves, kidney, and then obviously with your other GI tract also, which is the least out of all the problems that I just discussed. So what do you do in the annual screening? You need to look for any corns, calluses, fissures, because you need to keep your foot absolutely normal, spick and span. There should not be any little crack, because from that crack, infection can also start. And in diabetics, the propensity for spreading the infection is very fast. I mean, you can do a simple experiment, you just take a little bit of sugar, base, medium, and then allow it to remain like that for 2 days, just in the weather here. I'm sure you will grow hundreds of organisms. You look inside a microscope and you keep a second one without any sugar base, just keep a simple water, you will see at least 70 to 80% more in a sugar medium, because that is where the organisms love to grow. And this is exactly the same physiology what is happening in the body. Your sugar laden tissues are actually allowing the organisms to grow faster, and then obviously it can reach, as I said, up to the bone, which can cause all kinds of problems like hammer toes, bunions. And then if you have on top of it the vessel problem or the pipeline problem, you can have less amount of impulses. And the dorsalis pedis is a very simple artery. You can just Google it, and that is very easy to feel on the dorsal surface. If you have that which is low or not existing, again, you need to check with something called vascular Doppler, because that and neuropathy can become a deadly combination. So I'm not going to go about this, but there are risk stratifications which the doctor would do. Depending on that, you need to have a follow-up frequency. But my suggestion for you guys who are early diabetics is, as a general, this is please annually talk to your doctor and ask your nerve status. You go to the bank and ask your financial status, right? You go to the thing and say, what's in my bank, so the same way you need to ask a nerve doctor, what's in my nerve bank? How many nerves are preserved? What is going on in all the small fibers, the large fibers, single nerves, many nerves? So you need to take an account of it. And if you have one risk factor, which I just discussed about, but you still don't have any ulcer, or you are yet not amputated, I hope not that, you go to the stage of amputation, then every single visit, which could be once every 2 months or once every quarter, depending on when the diabetologist has called you, please make sure to get it checked again, because this is a dynamic process. Please understand, diabetes is eating up your organs every single day of your life, 24/7, 365 days. There is no one who can be spared if you are a diabetic. You cannot say that, no, I'm a special diabetic. No, that is not going to happen. You can only be a special or a blessed diabetic if you are taking care of yourself by controlling the sugar. There's nothing, there are no shortcuts when it comes to control of sugar. Somebody told me very nicely that it's okay, I can take the sweets and then take insulin together. Now, that's not the formula or fundamental by which the diabetes works, because if you are taxing your pancreas to release more insulin. There is only a little reserve which is there with the beta cells. I'm sure you would have learned that in the previous sessions. And if you exhaust that reserve, then that is gone, which is gone forever. So until now, there are a few studies of regeneration of those beta cells, and then pancreas transplant, and then insulin pump and all. I think we will talk about that in one of the sessions, where all the innovations in diabetes which is happening, it's in a fast pace. But until then, guys, it is very important that we physiologically understand the steps, how the sugar is eating our nerves, our other organs, and that is what we can do to prevent. Now, obviously, if you have two or more risk factors, there's no choice. I don't give you a choice. You need to ask your doctor every single visit, what is my nerve bank like? And because that makes you to do have a high risk foot, and high risk foot not just for ulcer but for cutting it, amputation. I talked about it, that 45 times more likely to be amputated if you are a high risk diabetic with a high risk foot. Now, there are some do's and don'ts which I will be talking about for 5 minutes. I think this is the most important last bit of it. I want you to hit home. The first message which I wanted to hit home for you is that don't take it lightly. It's the awareness which goes a long way, and this is what you need to do every single time that you are taking care of your food. So check your feet every day. There should not be any blisters, bruises, cuts. Use a mirror to see the bottom of the feet, because most people look up the top and all, but this, so you can use a mirror to check every single corner of your feet up there. Check the color. Is there any swelling? Is there redness? Is it warm? Is it cold? Wash. It is very important that you wash and then dry your feet, because the in between the toes are actually the where funguses can grow. The fungi is also like one organism that can grow, so you need to check that. Apply a very good lotion, so you need to keep it nice moistened, and do not let it dry. And change your socks every day, because that can also be a medium for infection. Trim your nails properly. If you have a little bit of a toe which can be ingrown, again, that can become a problem. And please make sure that you wear good supportive shoes. Now, shoes, I cannot less stress the importance, because everything, you're standing on your feet and you're standing on your shoes technically. So having the best, so if somebody asks me what are the two things which is very close to your heart and which you cannot give away, that's one of them is one of my shoes, special shoes, which I cannot live without, because we also stand for very long hours. So what you stand on it, and that is most important. Second thing obviously is my wallet. So it is very important to have a good wallet, and wallet which is filled, but the shoes is so important to be kept. Now, avoid extreme cold and extreme, because in the cold, when you are in the cold and if you don't have a footwear, all your pipelines will shrink, there won't be any blood, and immediately you can be at risk for getting this neuropathy. And definitely please do visit a podiatrist if you cannot do all this yourself, once every 2 months. I mean, we women do like to go to the parlors, right? So I think men also, there are enough instances of men being seen in the parlors, which is okay. But this is a special parlor of a podiatrist, which you should visit and must visit to take care of your foot. Now, what you should not do, because you allow those specialized guys to do that for you. So don't cut your own corns, calluses. Please do not bring razors and scissors to get rid of your toenails. Do not apply any heat with a direct water bottle or a blanket. You can have burns, because the sensitivity of the first thing which goes is that fine touch, or that sensation of temperature, which I talked about. The fine touch and temperature go hand in hand, and that can be the first thing to get knocked off in your diabetic neuropathy process. Don't take very hot baths, and then do not walk barefoot outside. I mean, yes, they say that it's good to walk on the grass barefoot to improve your eyes, but not for you guys, please. So that's an exemption. And do not wear any tight socks or knee-high elastics, and you should not wear any over-the-counter insole. Insole is nothing but inside your foot. Now, you need to make it customized to the pressure point. Some people have pressure at the back, some people put pressure in the front, some people have flat foot, some people have arched foot, some people have high arched foot. So depending on where you are putting the pressure, that should be a uniform distribution of the pressure. And that is the reason why wearing an insole. Now, why won't I wear a 4XL, when my size is just XL? I mean, that doesn't make sense, right? I mean, I should not be wearing a 4XL or a large when my size is XL, even in clothes. Then why do I need to wear a footwear which is not my size, when I already am at risk for having a diabetic neuropathy? problem. So this is the message here, that there are specialized techniques by which you can measure the insole pressure. You can computerize it, you can check it, and then make it to order for your type of the food. Please do that. And then obviously, if you are sitting for a long time, now sitting is the new smoking. Statistics are very, very clear every single hour. So there are some tips, which you can use to avoid that. I have to sit for 10 hours. I am a clinician. I don't have a choice. I can't call the patient in the garden. So at least what I can do is I keep my water bottle in my other room. So every hour I need to drink water. I need to go and get that, somewhere. Sometimes I also put my on the first floor. So I need to climb and go to the first floor. Now you have to devise your ways. If you can stand during your meetings, please do that. If you can have some calls which you can take while walking, please do that. But being conscious about this fact is so important. And obviously the true smoking also has to be avoided. A lot of people are fascinated by the word diet, which often, there's a lot of question. I spend about 10-20% of my time discussing diet, and then 80% of the times that's not being followed. So this is the Pareto rule, which I see it here always applying in the clinics. But diet does play such an important role, and dietary supplements as well. What is important to prevent neuropathy? Vitamin B1, B6, and B12. Those are the three key elements. There is also alpha lipoic acid. There is also some amount of other N-acetyl stuff, which is very important for the growing of the nerve. What is literally happening is, if this is the nerve, the cover is getting out. The cover is being eroded, and that cover needs to be replenished, and that happens by these agents. But what are the other stuff that you can do? Obviously, a healthy meal, vegetables, fruits, because all this have fresh nutrients. Now, off late, I just learned one very important thing, and I feel I should share it here. I was reading about, okay, blueberries are great for brain. There is so much of an X factor of serotonin and dopamine, and I wanted to just know the nutrients which can be good for the brain. And then suddenly I realized that there is one factor which we don't consider here, being in UAE. Most of the blueberries or most of the strawberries or cherries do come from United States, because we don't grow it here. In that transport process, all the preservatives are being used, all the chemicals are being used, or also they are dried up where they lose their nutrition values. So the best way to keep your nutrition intact and alive is using locally grown stuff, which you can immediately have, or at least have the least transportation. Otherwise, you feel good that you are taking it. I see Dr. Madhu is here, and she can vouch on what I'm saying, that you can feel that you are taking it right, but unfortunately, you are not actually doing a favor to your body. So eating something, and that's the reason why organic, without pesticides and all, has also been a big, huge hit with the people. So it's good, yes, but at the same time, make sure that it's also fresh. It's locally produced. Once in a while, other stuff is fine. Low fat, yes. Then obviously lean meat, fish, poultry, all that. Now, a lot of people are turning to vegan and vegetarian, which is perfectly fine. Make sure that your vitamin B12 is taken care, which can be easily taken care by just taking a pill. If your vitamin B12 is below 200, I like to keep it around 500. But although if it's below 200, around 150, just take shots, just take injectables, which means your body is not absorbing enough vitamin B12. Talk to your doctor. I think all this will be very easy when you talk to your doctor. Now, this is one point which I want to make clear, because this has been very off late. This is the latest approval which has come for people above the age of 50. This is the vaccine Shingrix, which is shingles, because the very common complication which we see in our clinics is, after you get herpes infection, there is a post herpetic neuropathy or neuralgia, which means herpes affects the nerve, and then that nerve starts to cry, and that crying of dying nerve can remain forever. It can be a very, very miserable symptom. And all that above the age of 50 you can do is just take the vaccine, and this vaccine can protect you from having this shingles, or what you call it, herpes. You may have had a chicken pox, you may have had a varicella vaccine, forget about it. This is the new recommendation. CDC has recommended all the adults above the age of 50 to get 2 doses of the shingles vaccine. Now, I have started to give this advice to my patients in the clinic. So if you have not been doing that, this is a great thing of starting to have it. I talked about the footwear. The typical footwear, the best footwear to have is a little bit of a deep white toe box, a shock absorbing sole, and an insole perfectly crafted to your foot, a designer insole. It need not be from Gucci or any designer shops, but it has to be customized for your feet foot design. And everybody has a different foot design, and then having a very firm heel counter and adjustable fastening. Do not put it like a slip-on shoes where it becomes tight and then it remains all the same the whole day. So your footwear is very, very crucial. And then if you do have pain, neuropathic pain, yes, when you come to us, we do give you some agents. But remember now, you are coming at a stage where the nerves are dying. What you should have done is come before the having this neuropathic pain, when we could have done something about it. However, we do have some agents like Lyrica, gabapentin, neurontin, etc., and all, which can help you reduce the pain. There is a very nice new patch which has been approved. It's called Qutenza. It's like a one single patch which can last for 6 months, 3 to 6 months. So you just put one patch. Let's say I have peripheral neuropathy. I can put one single patch in the clinic. It's capsaicin, 8% of capsaicin. It can burn very badly initially. Yes, for 1 hour you can be miserable. But after that, we have seen fantastic results in people with burning or other types of neuropathic pain which the patients have been suffering. It is done in the clinic. You cannot go and buy one patch, Qutenza patch. It's called Qutenza. Very good. I've been using it in my clinic and I do have a very good effect with it. So this is what you are seeing. It's an 8% capsaicin cream. Obviously, there are some advanced techniques which are being used in the world. If you have incessant pain, you've done everything and your pain is not being controlled, there are some spinal cord stimulation or peripheral cord stimulation or peripheral nerve stimulation devices which you are seeing up here, which can be used. Those are safe because now obviously you need to control the pain by non-medical, non-enhanced medical means. And we have a couple of patients whom we have used these techniques, because if you have a pain which is refractory, which is not being controlled by any of the medical means, it can make your life miserable. And this is what we can do. Now, a lot of diseases we ask, what is the disease modifying therapy? If I have multiple sclerosis, I ask that. If I have rheumatoid arthritis, I ask that. And if we ask in diabetes, what is the modifying therapy that I can have in diabetes, which can protect my beta cells, which can protect my pancreas, which can reduce the insulin and this. And believe me or not, there is no FDA approved drug. All is just doing the effect correction, your high sugar to low sugar, your high affection of nerve to low affection of nerve, but there's no disease modifying, believe me. But there are 3 disease modifying things that you can do is control your weight, stop your smoking, and your sugar control. This is it. This is what you need to modify your disease. And I cannot less stress the importance of the lifestyle and wellness and some of the yogic practices, some of the pranayams. A lot of people say which is the best pranayam for diabetes. There are many good breathing techniques which are very good for diabetes, but there is one which is very profound, and I will stop my session, which will be in a minute, with that pranayam to suggest that you should do that every single day. There are a lot of other complementary medicines which you can bring in, a lot of other exercises which you can do, reducing your stress, having adequate sunlight, eating all the stuff which is all the old herbs and all. But believe me, if you do one single pranayam, that is like being a retest of your self and body. And I'm going to show you that. This is the diabetic foot. Once you get a diabetic foot, it's absolutely incessant. You cannot repair it fast because now the tissue is not enough healthy. So you need to control the infection. You need to offload the pressure, and then it is antibiotic to treat it, infection, etc. And sometimes, with this type of diabetic infection, your life can be threatened. It can lead you to a death sentence. And this is what we don't want. You need to wear some off pressure casts if you have this foot ulcers or diabetic gangrene, etc. So overall, I think diabetes is a very important I would say an enemy, and we need so many people in the team to fight with multiple weapons. And it has to be an educator, a podiatrist, a physician like us, a surgeon, because we cannot heal the ulcer which is there, community health workers, people like professor who are into lifestyle wellness, all this, and obviously psychology, because I always believe there is psycho, neurophysio, immuno, endocrinology. psychoneurophysioimmunoendocrinology, which means it starts here and then goes down to your tissue. If you are not setting your mind right, forget about setting your diabetes right. If you are not working at the mind level, guys, there's nothing which you can do in that cascading fashion. And I like to say it faster, so I'm going to say it one more time: psychoneurophysioimmunoendocrinology. And that is what we need to make it happen. And obviously, you as a patient are our very valuable what I can say friends, and I want you guys to please pass it on to many other such friends of yours, and just putting it all in practice. Am I following my doctor's advice? Do I know my diabetes level? Do I know my nerve levels in my nerve bank? The type of the footwear, please go and check your footwear. Please do that touching the toe test and all the latest advances. I'm not touching upon that, but as promised, let me show you the humming bee pranayam, which you need to do for controlling the diabetes. All you do is you just close your tragus and this, you just with your two hands, and then just like a bee, just hum. I'm going to show it to you, and you can do it as long as you can. So I've been practicing a little bit, so it will be a little longer, but you start doing whatever you can. Okay, so this is how you close the tragus and then go Start 5 seconds, 10 seconds, 15 seconds, 30 seconds, whatever you can do. Do it 3 or 4 times in the morning and 3 or 4 times in the evening. It is very powerful. It fixes also the stress levels. Vagus nerve can be activated. Your parasympathetic, the good system comes into play. Your sugar control is better. And all this is possible very simply. We don't like simple solutions, but sometimes simple solutions go a long way. So thank you very much for inviting Professor for talking about the neuropathy. I hope, wish and pray that nobody suffers from amputations. Thank you. You're muted, Professor.
Okay. Dr. Sweata, I said fascinating for your personality and your profile. And now I extend that to fascinating for your talk. You did mention that you were a second opinion to Google, but I must tell you that you are truly a first opinion as far as the information that you have provided us. And it is so vast. I mean, you've covered the entire expanse in so many different ways. You said that smoking was a deadly combination as far as diabetes was concerned. You gave us that interesting touch the toe test. My spouse has never touched my feet, but I think if I were to tell her that Dr. Sweata has suggested this touch the toe test, that would be a great achievement for me. You have given us a few do's and don'ts, very simple do's and don'ts. You have spoken about the great value, and I appreciate this, the great value of lifestyle modification, diet, wearing the right shoes, foot care, and also our previous session was alternative therapy, and here is a highly qualified neurologist talking about a yogic technique. And I can see from the way you presented it that humming vibration reverberated through the entire body and obviously had an impact on all the organs and cells and nerves. But what makes it profound is the fact that a medical professional and a neurologist to boot is giving this advice. It only goes to show that 5,000 years of wisdom is being validated now by new, knowledgeable medical professionals. And I'm going to end my thank you by saying thank you very much for the advice on the psychoneurophysio immunoendocrinology.
You
I
did it
managed
right,
to
Prof.
say that.
Perfect.
Thank you so much. Thank you so much, Dr. Sweata.
Thank you, sir.
I of course have overshot my time, so I will ask Dr. Wilku to. I apologize to Dr. Wilku for talking as much as I do, and I will ask him to uh, translate the questions from our audience to Dr. Shweta.
Thank you, Professor. Thank you, Dr. Shweta, for a wonderful presentation. No doubt you are a brilliant speaker. You made it very interesting for understanding simple problems by mentioning technical terms into a simple pathophysiology of a neuropathy. Wonderful. So we have received a few questions, the email also, chat also, and now in the chat box also. The first question which I will take, Sammy is asking, I have a wrist pain and feel a lack of power in my left hand, thumb, and index finger. He has consulted an orthopedic, still he has not recovered. Is he
So
diabetic? He is worried about whether he is diabetic or not.
So you need to go and check it because this could be from sometimes, overuse or prolonged use. We all use mobiles, we all use computers. So once you go to us, I mean, once you come to us, we can assess and then let you know. And obviously, anything where numbness is involved, I think that's a second question which is there. You should check your sugar. If you have a high hereditary of having a diabetic parent, then definitely yes. Any numbness, any tingling, any fire or burning like sensation could possibly be an early indication of neuropathies, I mean, of diabetes. And that's why you have to go and test it. Yes.
Yeah, I think you have answered the second question also covered in that. Harshad is saying his age is 20 and he frequently suffers from numb sensation of lower legs. I am not diabetic, but both parents are. Is it an indication of developing a diabetes? You have already mentioned this. If you
So
want
I
to
will
put
give you an
some,
analogy. I'll give you an
yeah,
analogy here, and that analogy applies to all of us. If you have a loaded gun, all that you need to shoot to make a shooting is what? Just pressing the trigger. So having all the bad genes is like having a loaded gun in your life. The only trigger could be a bad lifestyle. It could be stress. It could be smoking. It could be sitting. So definitely, yes, you need to be conscious, as I told initially, aware, care, and dare. This is the time when you walk to your doctor and where all the screening tests or health tests are of benefit. You catch it early, you fix it fast. That's the mantra for diabetes.
very true, very true. This is a perfect answer with a good explanation. One more question, Prabha Ranjan is asking. I'm using high heels. Even last time we have discussed about this. High heels. So based on the site requirement, wearing 9 hours a day, whether I have to change it to low shoes. You have already mentioned how shoes should be fit.
See, a lot of shoe shops that you go, if you can go to a podiatrist, that is best, but ask for your insole design. They have computerized programs. So get your insole design based on the pressure points and then take a call. I think if you are a diabetic, believe me, don't even care, bother about your wallet. Take care of your shoes because everything, if you can protect your nerves, then, your life is easy. As I said, the statistics are very glaring when it comes to amputations or when it comes to ulcers. Now, if you can fix, again, if you can fix it with some common sense, I think we should fix it.
Yeah, true. There is one question just now popped on in my WhatsApp, and Joseph is saying, I'm diabetic. Recently, I noticed the color of my right foot has darkened, and I feel like he's walking on sponge, and he's worried. What is your suggestion? You have spoken about the gangrene. I think that will be the good explanation for that.
This is the early sign of developing a gangrene, and you need to immediately go to the neurologist, get your nerves, and as I said again, knock it fast. So you cannot wait. These sensations going, which means all the nerves, which I just talked about, are already in the process of dying, and you have to immediate. The moment the numbness happens, which means the crying is stopped and dying has started. So when the burning pain is there, it's crying, and when numbness happens, it's dying. So please, and as I'm saying dying, it's not dead. So before it's dead, please go to your doctor.
True. Most of the questions are similar in pattern. Let me see. Yeah, there is one interesting question. Uh, Shireen, she is saying, I am diabetic since 14 years and she is taking medicine. Her blood sugar is well controlled. frequently she suffers from terrible giddiness, and she had an MRI done, and which was normal. Is it due to diabetes?
Yes, so giddiness that you are suffering with a normal brain, and I assume with a normal ear exam, is coming from what we call as dysautonomia. The
Hmm.
balance between the parasympathetic system and the sympathetic system is so crucial. Now, normally what happens when we are in stress, there is fight, flight, freeze, our sympathetic becomes high and parasympathetic becomes low, while we just need a little reverse. We need your parasympathetic tone to be high, and this disbalance, what I just talked about, the humming bee, is a beautiful, beautiful pranayam to get this balance sorted. And that is which will be the reason causing giddiness. So there are people who can get sweating problem. There are people who can get persistent feeling like they're sitting in a boat, or feeling, a little bit lightheaded, dizzy, all these problems, or some weird pains which are fleeting in characteristics. All this is part of dysautonomia. Some people who sit and then suddenly stand, they can feel that there is a little bit of dizziness, or they cannot maintain balance. Some form of mild balance issues as well. All this is again a complication. Now remember, all this parasympathetic, sympathetic finally are nerves, and those nerves are actually the ones which are hit in the diabetes. So yes, this can be from that. And again, it needs to be, if it is not fixed with sugar control, there are other ways to fix it. I think lifestyle and possibly all these alternative sciences can help very much.
Yeah, true. Thanks, Doc. Almost all the questions are generally being asked for tingling sensation, crawling, pain, numbness. These type of similar
Same.
questions are there. Yeah, all same questions. I just yeah, there is one interesting question. Like the earlier person was asking, there is, he has not mentioned the name, he or she, I don't know, but the person is asking. He, maybe I'm taking as a he developed small purple spots on the leg, on the feet, both the feet, and he is diabetic. He is highly diabetic. His diabetes is not under control, and recently the doctor has started insulin. After that, the person is patient is finding these purple spots on the foot.
Yes.
So
So
is it concerned to neuropathy, or what exactly it is?
no, it can be from the skin itself, and that is the best way to get examined by a dermatologist. So it could be coming from the skin, but I would advise also to do this touch the toe test and decide if he is at risk for having the neuropathy. Once a year, guys, once a year is the time when you go and test your nerves with that nerve conduction study that I just described. So keep a record of your nerves. So at any time when there is there is affection of the nerve, that's when we start these agents, and then keep yourself abreast. That is where Google will come into play. Is there some new regenerative therapies? Is there something new which is happening in the field? You need to go and talk to your doctor about it, because it's a very, very highly advancing field. So many things are happening. Stem cell research is at its peak. The new regenerative cells are at its peak. And there would be one day, I'm sure 10 years down the line, we will be discussing those repair mechanisms and modifying disease mechanisms. So the point is that constantly being updated by it.
Yeah, thank you. So all the questions are covered now.
No,
My
but my
personal question.
question was
Yeah, yeah, okay.
basically,
I was
UAE
going
being
to
a
that point only. I was
small
going to that point
country
only.
amongst the common 150 countries, we stand 10th in the world when it comes to the diabetes. So technically, guys, it's a small country, but big impact of diabetes, 1 in 5. So if we total it up, I'm sure 2 or 3 people out of us are also going to be diabetic. So this is what we need to be worried. At the same time, if we are doing the right things, then not be worried. So let's do the right thing. And I pray for all people's well-being. Thank you again.
Very true, very true. And you have mentioned about three things, like you clearly said, it's not means like there is no restorative medicine so far. What we can do, we can manage and we can control the symptoms, becoming it more complicated. So that was a good thing. You have mentioned, which I was very curious. You should be explaining it. You have wonderfully explained. I would like you to explain it again. The foot test, what you have suggested.
Yeah, it's called the touch the toe test. So take any cotton, very small wick of cotton, and then ask your partner to do it or ask your friend to do it. Close the eye of the person whom you are testing it, and then touch it very lightly, randomly. Don't say which one. They have to say yes or no, whether they can feel the touch or no, and then mark it out from all the 10 fingers. If even two they are not able to detect, that's a sign that they need to go and test for the neuropathy.
Thank you, Doc. Thank you. I think everything is covered. Professor, over to you.
Thanks more, Dr. Sweata. Thank
Thank you,
you
sir.
so much. Thank you, Dr. Wilku, for those questions. I would like to thank the team, that would be Saloni Sadeh, for supporting us with this webinar. I'd like to thank our hospital for making this premises available, and IT for supporting us with technology. And most importantly and gratefully, I would like to thank our participants. As far as our next webinar is concerned, uh, on the 2nd, which is our next Friday, we have our National Day during that week, the National Week. Therefore, we will not be having any webinar at that time. But on the 9th, we have an interesting webinar. And that webinar is about the surgical management of diabetes. We have one of the world's leaders in this particular procedure. It is the surgical management of diabetes, and he has very kindly agreed to talk to us on the 9th on this subject. And I look forward to having all of you sitting again on the 9th for our webinar. Thank you so much and have a great day.